Hello, today I'll be presenting a case report on gas gangrene. I'll be presenting the report on atraumatic gas gangrene in synchronous colonic malignancy by Clostridium septicum. It is a very rare case report as 95% of time gas gangrene is caused by Clostridium perfringens, but this is a really rare case as this is included in the 5% where the gas gangrene is caused by Clostridium septicum. Now I'll read the abstract. A 44-year-old male patient came with complaints of pain in abdomen for 3 months and passage of black colored stools for a week. On palpation, an ill-defined firm lump was palpable at the right iliac region. Contrast enhanced computerized tomography CCT abdomen and colonoscopy suggested two separate lesions at ascending colon and sigmoid colon. Histopathological examination confirmed the diagnosis of adenocarcinoma. After 20 days of admission, the patient developed spontaneous sudden onset right lower limb gas gangrene. On emergency, right below knee amputation was performed by the surgeon. Bilateral aortoiliacplasty and stenting was performed for the same. Later, the patient underwent a total colectomy with iliorectal anastomosis. Clostridium septicum was the causative agent of the atraumatic myonecrotic gas gangrene. Unlike other similar cases where Clostridium perfringens is commonly the causative organism, spontaneous clostridial myonecrosis was associated with colorectal cancerous outgrowths. Piperacillin or tazobactam or meropenem and clindamycin are currently recommended antibiotics. Investigation with a CT should be undertaken. Repeated surgical debridements are necessary to achieve source control. The keywords for this report, that means the words by which you can find this report on PubMed, is Clostridium septicum, gas gangrene, myonecrosis, colorectal cancer, and surgery. Introduction. Some of the fatal conditions such as tetanus, botulism, and gas gangrene are caused by Clostridia species. Among the Clostridium species, the most frequently encountered species for gas gangrene is Clostridium perfringens. Gas gangrene is an extremely fatal infection of soft tissue which involves myonecrosis, that is the necrosis of the muscle, and is characterized by rapidly progressive gangrene of the injured tissue accompanied by production of foul-smelling gas. The first point here is Clostridium perfringens is majorly involved in myonecrosis following trauma, whereas Clostridium septicum is notorious for spontaneous myonecrosis. The second point of differentiation is Clostridium septicum are motile anaerobic spore-forming gram-positive rods, while Clostridium septicum can survive longer in aerobic conditions because it doesn't require the same rigorous anaerobic conditions as Clostridium perfringens. Malignancy, particularly colorectal malignancy, is strongly associated with spontaneous clostridial myonecrosis. Multiple primary colorectal cancers encountered in a single patient are referred to as synchronous colorectal cancer. Where more than one primary colorectal carcinoma has been identified in a single person after a predetermined period of time, the condition is known as metachronous colorectal carcinoma. To highlight the significance of having a high suspicion of Clostridium septicum in patients with malignancy, we report a rare case of synchronous colorectal cancer and the subsequent development of atraumatic gas gangrene. Now I'll read out to you the patient presentation. A 44-year-old male patient came with complaints of pain in abdomen for 3 months and passage of black color stool for a week. This was history of significant weight loss with an addiction history of smoking, 10 packs per year. On palpitation, an ill-defined firm lump was palpable at the right iliac region. CECT abdomen and colonoscopy suggested two separate regions at the ascending colon and at the sigmoid colon. Histopathological examination helped us in confirming the diagnosis of adenocarcinoma. After 20 days of admission, the patient developed spontaneous sudden onset right lower limb gas gangrene. Microscopic examination of foul-smelling secretion suggested presence of Clostridia. So the patient developed spontaneous myonecrosis, which is atraumatic gas gangrene. The figure shown here as you can see, shows right lower limb atraumatic trauma, below knee spontaneous gas gangrene. uh, Management of the condition. Treatment: an emergency right below knee amputation was performed. Digital subtraction angiography of bilateral lower limb was done post amputation, which was suggestive of extensive atherosclerosis of both the limbs. Bilateral aortoiliacplasty and stenting was performed for the same. Definitive treatment: later patient underwent total colectomy and iliorectal anastomosis. Two hard lesions were found at ascending colon and sigmoid colon. Histopathological examination suggested well differentiated adenocarcinoma. It was a T3N0MX stage 3 mutation. As you can see, here are the CT and colonoscopic images where you can see the growths present in the ascending and the sigmoid colon. As you can see, this is the photo of the total colectomy specimen which we had removed from the patient. It is dissected beautifully and it shows an ascending colon growth and a sigmoid colon growth as mentioned above. Now I'll come to the discussion. The overall incidence of synchronous colorectal cancer is 2.3% to 12.4%. Clostridium septicum is known to cause atraumatic myonecrosis in such malignancy. The occurrence is rare but highly fulminant. Gas gangrene can cause myonecrosis, muscle tissue death, gas production and sepsis. Progression to toxemia and shock is often very rapid. It can easily be noticed by large blackened sores that form, as well as a degree of loud and distinctive crepitus caused by gas escaping the necrotic tissue. This is, friends, why it is known as gas gangrene, as we can feel crepitus below the skin due to the escaping of gas. A study by Najapa S. et al. Stated that the presentation of Clostridium septicum bacteremia might vary and is fatal in more than 60% of cases. If a diagnosis and appropriate measures are not initiated soon, the majority of deaths happen within the first 24 hours. Clostridium septicum are more aerotolerant and associated distinct atraumatic myonecrosis is likely due to hematogenous seeding. So that means that the most common spread is by hematogenous route. Conditions precipitating hypoxia such as chronic inflammation, chronic ischemic conditions like atherosclerosis and anaerobic glycolysis by tumor cells are the risk factors. As you could see in this patient, he had atherosclerosis in both his lower limbs. Hence, he had a higher chance of acquiring gas gangrene. The treatment is always aggressive since the average mortality rate is higher than 60%, especially if appropriate treatment measures are not started urgently. Hence, we can see in the above discussion that the patient's limb was immediately amputated when he had reported to the hospital, as gas gangrene having a high average mortality rate requires urgent measures to be taken to save the life of the patient. Ultimately, the patient also needs aggressive resection of synchronous malignancy of the colon, and after the amputation the surgery was done and the ascending colon and sigmoid colon growths were removed and were also sent for histopathological examinations so that we could know which type of tumor it is, and it turned out to be an adenocarcinoma. Conclusion: infection with Clostridium septicum, although rare, can lead to fatal outcomes and a poor prognosis owing to its highly virulent and aggressive nature. This warrants early identification and initiation of treatment with an aim to decrease mortality. Patients who present with an underlying colonic cancer and signs of infection or sepsis should have a high degree of suspicion that they might have a Clostridium septicum infection. And here are the references from where I have formulated the points. You can go through it, and thank you to everyone.